and I was given an ultimatum. You close your business or you're going to be terminated. I cried for 3 days. And my
Oh.
husband, my sweet loving husband, comes in and says on the third day, "Aren't you a nurse? Can't you go anywhere and work?" And I'm like looking up at him and say, "Oh, I am a nurse. I forgot." And that day, I wrote my resignation letter and I chunked them the deuces. Hello, everyone. I'm Quisha Umemba, CEO of Umemba Health, and you're listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Let's get back into the richness of the discussion. We
All
left
right.
on a cliffhanger of new company. You were open and honest about sharing experiences where it didn't quite work out the way that you wanted. You shared sort of, I had a big vision that didn't really resonate when I had partners. And then you had some foresight around going virtual for these different opportunities. And that was sort of before COVID, but not really seeing eye to eye with your partners. Then you branched out, did your own thing.
Yeah.
You talked about approaching failure or potential failure with like courage and honesty and driving. What was the term that you used? Do it scared.
Do it scared.
Do it
yeah.
scared, right? Do it scared. And then you did it scared and you had your own consulting company now.
Yeah.
Now, we're in that seat. Talk us through how that came about.
Yeah.
What are the types of things that you're doing now as part of the services that you're offering?
Yeah.
Talk to me about whether it's colleagues or just the self-doubt in your head, maybe saying, "Oh, this is not going to work." How you overcome those things.
Well, buckle up because this is good
Yeah,
stuff.
this is what we want. This is why the people are here. Let's talk about it.
Okay, so yeah, 6 months at the state. I told my husband I'm bored to death. I'm going to start another business. What really motivated me to start Umemba Health at the time as a diabetes nurse consultant, one of the things that I was in charge of doing was helping organizations throughout the state incorporate a virtual component of their DSME, Diabetes Self-Management Education Program.
And is that something that you pitched or that they were looking to do and then you just
This is
happened
something
to...
that they were looking to do anyway. It was part of interventions that had come down from the CDC, which is where we were getting our funding.
Wow.
Okay. Now,
Alignment.
which is again why I'm reading the trends, right? I'm seeing where we're
Right.
going and where the money is going, which is how I am now in my business. Very, we used to say something called follow the funding, right? So I'm already looking at the interventions that are expected or just basically the trends where we're going in public health. So I kept having an issue, or organizations kept having an issue, because this is foreign. This is pre-COVID. And so, organizations, a lot of bureaucracy, a lot of red tape. Oh, it's too expensive. What are the HIPAA compliance? I mean, I just kept coming up against thing after thing after thing. And I told my husband, it cannot be this hard to teach diabetes education virtually. I'm going to start a business. I'm going to do it. Everything that I learn and figure out on my own, I'm going to go to work and I'm going to share it with our clients. And that is exactly what Quisha did. And so I started Umemba Health. For the first 5 months of my business, it was chronic disease education. I had 4 areas: diabetes education, diabetes prevention, kidney disease education, and heart disease education.
Okay.
And so for 5 months, I did workshops, webinars, one-on-one. A lot of it was just family and friends, right? Sometimes I would have a webinar and nobody be there but my mom, dad, my 2 sisters, and that was it. But as I was learning, I was researching which are the best curriculums to use virtually. Can I show somebody how to draw up their insulin and inject it virtually? And as I'm figuring out, okay, these platforms are HIPAA compliant and require a business associate agreement. These curriculums work the best. Everything that I'm learning, I'm just going back to work the next day, and I'm saying, look at this curriculum, look at this platform. This costs this much for this amount of users, and it's literally real time research that I'm conducting in my business
Implementing.
that I'm implementing, absolutely, that I'm then going and sharing with my clients. And it was helpful for some of them that were more nimble and able to move quicker, but still so many were just reluctant. They just couldn't see how patients would just want to be at home and join a class on their phone or on their laptop. It was a hard sell. And so I then, across the hall, was the community health worker certification program, and they needed a speaker for a conference. Day before the conference, one of their speakers backed out. And so I got a call. Hey, Quisha, you think you can speak at the CHW conference tomorrow on diabetes? At the last minute, one of our speakers backed out. And I said, yeah, sure, I'll put something together. Now, mind you, I had applied back from my HHD days to be a CHW instructor on 2 occasions and got denied on both occasions. So I go to the conference to speak on CHWs, or speak to CHWs about diabetes education. And the presentation was so good, afterwards, they tell me, could you please apply to be a CHW instructor? Got denied twice, right? Now they're begging me. So I apply, I get approved to be a CHW instructor, and I'm like, so can I charge for workshops? Yeah, oh yeah, sure, you can do what you want to do. So the first thing I did was I charged for a workshop. It was on capacity building. And there were quite a few people that came to that workshop. And that's when Umemba Health became more known than it was. And I got an email from my supervisor that said, Quisha, we just got word that you started a business called Umemba Health, and you did not fill out the conflict of interest paperwork. And so I knew that I'm going to be honest, Gordon, I knew that if you work for the state of Texas and many government agencies, if you have outside employment,
Okay.
you are supposed to fill out a conflict of interest form. However, because my coworkers that worked at Lowe's and Claire's and the dollar store and all of those places, they were working part-time, and I talked to them and they did not fill out the conflict of interest form. I thought, I'm not going to fill out the conflict of interest form either. So long story short, I filled it out. They denied it. I tried to fight it with the union. I noticed it wasn't going to go anywhere, and I was given an ultimatum. You close your business or you're going to be terminated. I cried for 3 days. And my husband, my sweet loving husband, comes in and says on the 3rd day, aren't you a nurse? Can't you go anywhere and work? And I'm like looking up at him and say, oh, I am a nurse. I forgot. And that day I wrote my resignation letter and I chunked them the deuces. Yeah.
Wow, I didn't know that.
Yeah. Absolutely.
Wow. I had a similar-ish situation to that. So I definitely see where you're coming from, where you're put in a position to make a choice.
Yeah.
About your passion on the side, quote unquote.
That was it.
And like something. So that must have been a turning point. Yeah.
Oh, it was hard. It was difficult, and I hated it. I didn't hate the job, but it wasn't fulfilling the job.
Right,
and my husband was like, "You don't even like the job. Why do you even?" But you're used to the 2-week check, right?
Yeah.
And my business. I mean, I just started making money, but I mean, not anything to be sustainable.
You're not ready to do that.
Not ready at all to take the leap. But you know what? I'm so good at taking leaps of faith. And I told my husband, I said, the next place that hires me is going to hire me because of Umemba Health, not in spite of Umemba Health. I put Umemba Health on my resume, I put it on my cover letter, and I updated my LinkedIn. And
I'm here.
And I got a message from a company, a consulting agency, that basically in a nutshell said, can you come to our company and do what you do for Umemba Health? Because Umemba Health was a virtual provider, virtual education pre-COVID. So when COVID came, all of the agencies were scrambling to put everything virtual. I was already doing that in my business. So I went to go work in corporate America at a value
Mm,
based care agency. And that's what I did for 2.5 years as their training specialist. And I trained their internal consultants, and we also trained external clients as well, on Zoom. I created courses, did voiceovers, did all of that. Everything that I had been saying from 2017, I think we need to go
mm,
virtual. I think we
mm.
need to go online. I wish I had been saying it from 2000,
Right,
because I'm
right,
like,
right,
man, the money I could have been
right,
making if
right.
I asserted myself as a leader in that space pre-COVID, right? We can't tell these things, of course. And I went through 4 interviews, and every interview they asked me about Umemba Health. Every single interview. And how are you going to be able to manage your business? And at the time, I said I was honest, but I also did tell a little white lie.
Yeah.
I said, first of all, my business is new. It's just starting. I don't have, clientele like that. And I said, and plus, it's not just me. I have a team. I have a couple of virtual assistants, and I have a subcontractor that I can reach out to if needed. Didn't have any of that. Just
Hmm,
lie.
hmm.
Forgive
Right.
me. But I brought those people on within 3 months because I knew I had in order to work my job full time. And that's how I
Mm,
was able to work 2.5 years in that position, because I
right.
had subcontractors and virtual assistants.
Okay. See? Hey, it's very refreshing that you're talking to about balancing sort of your kind of corporate employment with your budding business and how
Hmm.
you reconcile the two and
Yeah,
what infrastructure needs to be in place for that one while you continue to earn here,
yeah.
learn a trade, kind of see what works and what doesn't work. And then I'm curious to hear when did you ultimately have that
Well,
point where you're like only doing I'm focusing on my stuff.
my business,
When
yeah.
when did that come?
Yeah, so I started making money. I remember one year I made 85K in my business,
Hmm.
and I was making right at 100K with my job. And I told my husband, I said, hey, I only made 15K less, with my business. I said, remember I said when I start making more money in my
Hmm.
business, I'm leaving. And so we put together a 12-month exit strategy plan because I knew I would hit that within 12 months. I finally started getting some traction. COVID money was it
Mm.
was free for all, just about it.
Hmm. Hmm.
It was a great time to be in
Hmm.
public health consulting right after the
Hmm.
onset of the COVID-19 pandemic. And so we put together this 12-month plan. I knew I wasn't going to have 100K in
Hmm.
savings, right?
Hmm.
We had said something like 45K in
Hmm.
savings, and I had this criteria, or this many number of clients, or this whatever it was. But December 31st of that following year, I was going to be done, and then May of the following year. So we're talking about half the time. I secured 2 clients at one time, which totaled about 75K. And I told my husband, I said, I think this is time. I said, if I can get these two, they will carry me until I get the next client. And I remember, I always laugh about this because I treated it like a business deal. We were sitting on the back porch, and my husband was kind of squeamish about me leaving, of course, because I'm
Yeah,
I'm making
of
decent money.
course.
And I took a piece of paper and I wrote down the number.
Ah, I see. I'm
Uh,
seeing it in my head. Yeah, I'm
yeah,
seeing that in my head.
I,
Yeah,
I
yeah,
took a piece of paper and I folded it up and I slid it across the table on the back porch, and I
smooth.
said, "This is the amount that I would make if I didn't have to pay out to contractors and stuff to do the work." And he opened,
Okay, 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 okay.
yeah, because I had to pay other people to do it, right?
In your absence of being full time now,
Exactly,
that's right.
exactly. And he opened it up and he looked at it and he was like, "So you mean to tell me we can keep most this money if you quit your job?" And I said, "Yes." And he said, "Do what you think is best, baby." And I sent him, that was on a Saturday, and I gave my resignation on a Monday. And I pitched my consulting services in my resignation, and they were a client for a year and a half.
Stop. You pitched your consulting services up on your resignation. Okay,
I
well,
did.
well, to be fair, now that I think about how you describe it, they were very curious about your company anyway, so maybe that's why you felt
Well,
it was
not only
right.
that, I knew there
Yeah.
would be a void. I was the only clinical programs training specialist. And so there
Oh,
was
what a
going to be,
move.
absolutely. Let me tell you, it's nothing but looking for a need or a gap. I know this is going to leave you with a void. So let me support you in the meantime, right? And let me also hire onboard and train my replacement whenever you get to that point. And yeah, so that's, yeah. So, yeah.
We can end it here. I don't even know what else to ask you after that. That's you
I
slide the
know.
paper to your husband Saturday, then Monday you're resigning and then pitching your services, and then it materialized.
It materialized,
Oh
yeah.
my gosh. Okay, I'm gonna go back to maybe not doom and gloom, but a reality that public health
Mhm.
practitioners face. So I really like the example of the conflict of interest. Like that's a reality that
Mhm.
people have to
Mhm.
navigate if they have
Yeah.
like formal employment, especially government, for example,
Mhm.
uh, balancing like doing a dual role where one is kind of for your business and one's for like a government agency. That's
Yeah.
a real challenge. But the other challenge that I find that public health practitioners have is just profit and like making money is such a scary
Mm.
word. It's seen as sort of unethical, immoral, and it's like how
Mhm.
can we're supposed to serve communities and advance health for people all over the
Mhm.
world in your local area. How dare I have an infrastructure where I can make money and eat good
Mhm.
and live good
Mhm.
and that's sort of a big reason that many practitioners are reluctant to step into I would say not consulting specifically, but like being a business owner
Mhm.
because you can consult and work for someone else.
Mhm.
So being a business owner that's like a barrier for a lot of
It's a
people.
big mindset
What
barrier.
what are like was that something you went through in your head or what would you say to people who go back and forth on this?
I never struggled with thoughts that my expertise and skill set were not worth the top dollar. I've
Right.
never
Okay.
struggled with that.
Right. Right.
I have struggled with, do I think people will pay me for what I think I'm owed? I'll give you a case in point.
Okay.
My business coach at the time when I left my corporate job, I said, how much should I charge them? They've already said, yeah, Quisha, we want to keep you, consult with you, whatever, whatever. And she said, well, we looked at my job description and what I was doing and what I was going to keep doing. And she said, quote them 350 an hour. And I said, oh, girl, I can't quote them 350 an hour. I think they're paying me like $55 an hour
Mm.
now. Like, she was like, yeah, but you're a consultant. Quote them 350 an hour. So they sent me all the paperwork and one of us said, well, what's your hourly? And I was like literally my heart was thumping. These
Wait,
people
was
are,
that like a verbal exchange like when they asked you or
no,
was it
the paperwork, you fill
okay,
out the
okay, the paperwork.
paperwork.
Okay,
Yeah.
okay, okay. So you're
And
like, oh my
so
gosh, I actually have to write this
I
down.
actually have to write it down.
Yeah,
It's
yeah.
going to be, and I'm like, there's no way. And so
Drink some water.
I put 250. I'm sorry, she said 300. I'm sorry. I put 250.
Mhm.
And then I'm like, oh, Quisha, I'm proud of you, girl. At least you put 250. You know what I'm saying? Like, I'm like, I could not do 300. I'm going to put 250 with
No,
the expectation they're going
no.
to rebuttal. The next email was
Okay.
your equipment will be your laptop. Your equipment is going to be mailed and such and such. And I called Tiffany. I said, Tiffany, I put 250 down and they didn't say anything. They didn't blink an eye.
She's
And the
like, I
first thing
told
she
you.
said, we should have started at 350. And this is before I realized there are consultants making $1,200 an hour.
Whew.
And so that was the first big lesson on my own that I
Mm.
where I was like, there are organizations willing. They see you
Mm-hmm.
as this valuable expert, or they wouldn't be paying you every 2 weeks for it, right? There are organizations that value your expertise so much that they're willing to pay that type of money. And I even had, about a year later, one of the individuals in which I will communicate with, she said, when we went to talk about the budget this month, someone said, why are we paying Quisha more than we pay the on-call docs? And she said, well, Quisha has her own business and, the doctors work at the hospital and da-da-da, but Quisha runs her own business. And I said, because that's what Quisha asked for.
Mm.
And that's what Quisha deserves. I can't help it that they didn't ask for 250 an hour.
That's not your problem.
It's not my problem at all.
Mm.
So my thing, and I didn't always charge 250 an hour, right? When I
Mm-hmm.
first
Mm-hmm.
started consulting, I was $50 an hour. With
Mm-hmm.
every project, and
Mm-hmm.
the more I saw my work getting better, the more it boosted my confidence, I would go up 75,
Right. You didn't
100,
want to price yourself out
125.
earlier.
Well, you
Right.
don't know, first of
Yeah.
all, what people will pay you for,
Yeah.
right? So before I got my business coach, and I'm just like 50, 75, 100, I'm just seeing, first of all, I'm getting better, so they got to pay for this. Now, when I go back
Right.
and look at my initial projects, I'm like, ooh, I charge people for this? This was horrible. But now I'm like, oh yeah, they finna pay for
You're getting this.
this.
Yeah. You're
Yeah,
getting
you're
this for
you're
that.
getting this great service or product. Absolutely. To your point, it is one of the biggest challenges, and it's not just I say helping professionals. So if you're a nurse, you're a
Okay.
social worker.
Right.
So I
Right.
group it into helping
Right.
professionals.
Right.
When I was looking for co-authors for my book, I specifically had one person tell me, I can't be in a book with with the word profit in the title. I don't
It's
want my
that deep.
clients to read a book that I'm in with the word profit in the
Wow.
title.
It runs that deep.
It runs that deep. And the subtitle of my book is Navigating the Intersection of Purpose and Profit.
Right.
So
The
it doesn't
purpose.
matter that we're talking about how to find the balance of doing what brings you purpose and being able to still have a good living, maintain a good living doing it. The fact that, like you said, that word profit is automatically a knee jerk reaction. When I know without a profit, I cannot make impact. I
Hmm.
cannot. I am going to get burnt out if I'm so hungry, working all these hours and pouring into individuals and communities, and I know I can't pay my bills and and my ends are not meeting. I'm going
Hmm.
to get burnt out. I'm going to lose passion for this. At some point, I don't care what anybody says. At some point, you will lose your passion and your drive to do that work if you are living in the same situation as the people that you're helping. Don't get me on that soapbox, Gordon, because I could be there all day. I could be there all day. And I will also say this: nobody becomes an entrepreneur to live paycheck to paycheck.
It's
And
just
so
not
if
sustainable
that's,
anyway.
it's not. It's
Hmm.
not. Yeah. So if that scares you, then entrepreneurship is not for you. If the word
Hmm.
profit scares you, then entrepreneurship is not for you. Yeah.
Hmm. Yeah, I'm gonna have to sit. I'm sitting with that one because it's a real thing. Like
Yeah.
that example of the person that didn't want to be associated with the book because of
That's it.
making
Yeah.
money, profit, and it's kind of a reflection on how we talk about, oh, it's a capitalist society, big pharma profits, so
Hmm.
you're just as bad as big pharma if you're
Yeah.
like a little business profiting. But that's you're
But
like
it just
we want to
depends.
live.
What I do with my money is different than what Big
Right, right.
Pharma
We
does
want to
with their
live,
money,
and then
you
you're
know?
also saying my services are worth X. If you want it, pay me for it,
That's it.
right? But and then the other thing too, I think is very important is your business model. It sounds like is more, I guess they would call B2B,
Yes, I do
right?
have well, we have
Some
online courses. So we have
right, right,
Umemba Health Academy, which is our
right, right,
virtual campus.
right,
So
right.
individuals can enroll in that, but primarily B2B contracts.
Right,
Absolutely.
right. So you're not showing up in communities doing diabetic education, asking people for $5,000 for a class. Like so,
Oh,
I think so
no.
that people kind of, oh, you're charging people lots of money. Like I'm
Right.
charging businesses who
Yes.
can
No.
afford,
I'm
who
serving the
have budget.
people, but the organization is paying me. Some
Exactly,
company is writing the check. I'm serving the
exactly,
people. Yeah.
exactly, exactly. And then
Yeah.
through your services, you're also advocating for a need to be filled.
Hmm.
You were talking about equity deserving
Yep.
populations, and then you're getting that. If that money doesn't go to you, it's gonna go to something else.
And somebody else who may not do as good as I'm going to do
Right,
and
right.
have the heart to do the work with the right intentions. You're hitting it right on the head. Yeah.
Exactly, exactly. Now, tell me a little bit more. So, as the years went on, and when you went exclusively into your business, how did your service offerings evolve as a result, and like the types
Mhm.
of clients that you would see, just so people can understand
Yeah.
that like final, or not final, because you're still doing it. So
Yeah, yeah, yeah.
the
And I
evolution at this.
refine every year. I
Right, right. The
refine. Yeah.
evolution at this very moment as I talk to you,
Yeah.
what does it look like right now?
Yeah. So we are, for all intents and purposes, as far as business speak, we're a woman owned, minority owned management consulting firm. We differentiate with our specialty of workforce development. I personally
Mm,
choose workforce development. So we develop curriculum, we develop courses, we do a whole bunch of stuff, but I'm very intentional. There's a lot of consultants that will say, oh, I'm a curriculum development consultant. I need to weed myself out of that, right? And so we are workforce development experts. Now, what does that look like when people come to us for workforce development or public health services? That is workshops, that's facilitation, that's speaking services. Our number one service is curriculum development. We write curriculum all day, every day, if not for ourselves internally, for our students that we teach, for our clients as well. We do a lot of resource development. We do a lot of toolkit development. If your public health agency or your healthcare system, your clinic, whatever, want their staff trained, we can train on it. And so we do things like recently we trained the health department on diabetes equity. That was a half day workshop. We've done compassionate care for the unhoused population. We do a lot of half day trainings. Healthcare navigation for community health workers. Recently, an organization hired us to do their entire virtual symposium. So we did a full day virtual symposium, our own speakers. We distributed the CEs, all of the PowerPoints, all of the curriculum, all of the everything. So if it is public health, education, and training, we do it. Now, on the consulting side of the house, program development, project management, and then training. A lot of times they'll say, can you put a training together, and it's train the trainer. We train the staff, they do it. But then sometimes it's, can you actually put the training together and deliver it as well? I really like where I am right now. It's been through several iterations, and sometimes in the beginning I would take a project kind of outside of what we did and be like, why did I do that? I thought I needed the money, or maybe I did need the money at the time. But now I feel like we have a sweet spot. And as I am probably about a month shy of being a certified AI consultant, we're going to be adding AI, which we tested and piloted in 2024. But I would like to say Umemba Health is an AI-powered training organization. And so earlier when I was talking about the time that I save with AI tools, we have incorporated AI into our content development, into our video creation. We use AI voiceover now. We used to do the voiceovers for all the videos and courses that clients would have us create. We use AI video now. We use AI for our research. We use AI in every single step of our curriculum development process. And that's why it literally takes 50 or 60% of the time to put together courses and curriculum than it used to. So I'm really excited
how did you
about that.
certified AI? What's it called?
Yeah, so there's the International Association of AI Consultants. And so I'm taking a course. I've been in it for almost a year now. I just haven't been advancing through it as quick as I should, but I'm almost done. I just need to do my final presentation. But yeah, check out the website. There's a lot of individuals. There's AI teachers and people in AI marketing and ads and all kinds of things. And
You're
so
really about the trends. You really.
I am. If you haven't noticed, I am.
You're not like, oh, this is my comfort zone. You're like, I need to go here because.
But I was reluctant.
Oh.
So when I got on the AI train a little over a year ago, because I'm very much an intellectual. Oh, I would never. I'm a writer. I'm going to do it myself. I'm going to, I can't.
Yes,
that's
I have that
cheating.
human touch,
That's right. That's cheating. And so a friend of mine who is a nurse entrepreneur herself, she said, Quisha, you sound just like our parents did in the 60s and 70s when the internet came. And she said, and they got left behind. And when she said it, it was like a slap in the face. I was like, I do sound like those people. And so that's really what it was. I said, I cannot get left behind because I've seen what it's done for how my mom is when it comes to technology and the internet and stuff like that. And I said, I cannot get left behind. So I was not a big proponent of it at first. But now, absolutely, I'm talking to health departments about going to speak and train their staff on how to incorporate it in not only curriculum development and speaking, presenting, but how it can help in health promotion programs specifically, health equity interventions and different things like that. So, yeah, I've been working on some stuff, but I can't. It's so much going on that I have to pick and choose what I work on and what's front and center. So it had been front and center for 2024.
That's awesome. Now, we're coming towards the end, and trust me, I could talk to you the whole day, and I really mean it, because even before we started off air, it's the first time I've ever just talked to someone for like 15 minutes straight before we even started recording. So I think you have a lot to say. You're very open. I think something about that like draws me to like listening to what you're saying. So to finish things off here, any final messages you wanted to leave people with regarding
consulting, owning a business, the type of mindset that you might have, fear of
Yeah.
success, fear of failure. Like, summarize your final
Yeah.
thoughts.
Well, first of all, it is possible. That's the first thing, right? I always say, my mother used to tell me when I was a little girl, you can be anything you want to be in the world
Mm,
if you put your mind to it. And I never really understood that until I become an entrepreneur. And I was like, one day I
right.
was like, this is what my mom said. Like, I will not negate the fact that I get to wake up every single day,
Hmm.
come to my office when I want to, work on the projects that I want to, work with the clients I want to. I just turned down a project 2 days ago because as it kept sitting with me, I started
Mm,
thinking about, is this going to suck the air out of the room? Is this going to bring me joy? Is this going to be more stress than it's worth? Am I really going to meet the expectations of the clients?
mm,
And I told my husband, I said, this was our first project of 2025, and I don't think I want to take it. And declined it. I wrote back after the meeting and said, I'm, I'm just going to decline it at this time. Of course, I gave a professional
mm-hmm,
rationale and then offered my services on a retainer basis because you
mm,
always want to offer
mm-hmm,
your services
mm-hmm,
some other kind of way. Um, but when I think about, I have this choice of how I choose to serve every day and the impact that I choose, I'm living the dream.
mm.
Like, there's not anything else I could even imagine, like, aspiring to. Like I always tell people, if my student loans get waived, like some of my family and friends I know, I'll go back and get my doctorate, right? That's the only way I'll go back and get my doctorate if my student loans are wiped out. But other than that, I don't aspire to do it or be anything else.
Mm.
I've just celebrated 5 years. Most businesses, 50% of businesses don't make
Right.
it 5 years. I've
5 years.
just
Yeah.
celebrated 5 years in business. I know I could continue to do this forever if I wanted to. Every year I get better, I get smarter, I learn from it. Um, so I'm just happy. Even I asked my husband last year, we were going through some personal things, and we had amassed $50,000
Mm,
in IVF. We were trying to have a baby.
mm, mm,
And I was like, well, maybe I should just go back to work.
mm, mm.
And he said, no, you are so much better working for yourself.
Mm.
He doesn't even want me to go back to work for
Wow.
anybody. And so if that is your dream,
Yeah.
it is possible. I never knew because I didn't, some people come from a family of entrepreneurs, right? I
Mhm.
didn't. When I left that six
Right.
figure job, my aunt said, what are you doing? We don't do that. We as in black people.
Right.
She said, we don't do that. What are you
Uh-uh.
doing? You
Hmm.
leaving that good paying job? And I said, well, Amy, I said, I know
Got the
we don't do it.
benefits. You got all that.
Yes,
Yeah.
yes. She
Don't
was
do
like, what are
that.
you doing? The
Mm.
same aunt quit her job last year to try
Mm.
entrepreneurship. The
Stop.
same aunt. Didn't last long, about 6 months. She went back to work. But it's
But
the
that's a
fact
big
that
step. Yeah.
it's a big step. That she's older, 50 plus, and had never seen, because she'd never seen anybody do it. That alone just makes me feel like, okay, this is what I should be doing, Quisha, just to let people see that there's a possibility. And as a nurse, as a public health practitioner, as a helping professional,
Hmm.
you can still make a difference. You can still make impact. I feel like I make more impact now
Mm.
than I did when I was working at the health department and the state health department. And that it's just no better feeling than that. And the fact that I get to make the impact that I'm making
Hmm.
and also make really good money doing it because
Mm.
of contracts that are going to be paid to somebody anyway is a win-win situation. So I don't know if I've answered your question or not,
Oh,
but
that's beautiful.
but it is possible. First of all, do you have to get over, yeah, you got to wipe out that employee mindset. Not
Right.
completely. There's a lot of things
Uh-huh.
that you learned as an employee that are going to carry you, and that's great. But the mindset to be an entrepreneur, to be self-employed, is completely totally different. Fear of failure, you got to let
Mhm.
that go. As a matter of fact, fail early and get it over with.
Mm. Fail.
Fear of success,
You have the most quotable.
really?
Fail early and get it over with. That's
Fail
another
early and
t-shirt.
get it over with because you need to know what it feels like,
That's
right?
another t-shirt.
You just need to know what it feels like and get it
Yeah.
over with.
The anxiety of just let it happen.
Just let it
Oh, it's not
happen.
the end of the world, right?
That's it. That's
Ah.
it. Okay, let's try something else. Fear of success. I still
Mm.
struggle with that one. I still will struggle with that one. I have that one more so than fear of failure because I know what I'm capable of. And if I really put myself out there,
You'll get into some big stuff.
I'll get into some big stuff. And I'm
Mm.
at the point of my life and my age. Do I really want to do that? Right now, I took four vacations this year. Nigeria, Costa Rica. I went on a cruise with my 14-year-old
Mhm.
and Mexico. It's the first time I've ever done that much travel, right? That's where I'm at in my life. I'm not trying to do all the things
Mm.
anymore and be on all the stages anymore. I was 10 years ago. So I have to teeter totter between, okay, let me do this, but let me also pull back a little bit because I know you, Quisha. If you put yourself out there, you're going to be on all the stages doing all the things. And I'm just not there in my life anymore.
Mm.
So fear of success is a real big one for me. Does that make sense?
I can totally relate to what you're
Yeah.
saying.
Yeah.
Oh my gosh.
Yeah.
So,
Yeah.
did you want to say where people can find your book too? I wanted to
Absolutely.
make sure.
Yeah. So the book is Public Health Entrepreneurship,
Mhm.
Navigating the Intersection of Purpose and Profit. You can find it on Amazon, of course, if you want to get it in 2 days or
We'll put
less.
the links in the description.
Or you can go to QuishaUmemba.com and you can get it there as well. And if you're interested in finding out how we can serve your organization through public health services, workforce development, and health equity initiatives, visit UmembaHealth.com for more information.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music, From the Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.